Okay, so I saw my first video, and it didn't actually look like you guys could hear me very well, so I will start the next video with my face right up to this thing. Okay, so the next terminology. Alternating pressure mattress. Okay. Alternating pressure mattress. A pad similar to an air mattress that can be placed beneath the patient to reduce pressure on the head, shoulders, back, heels, elbows, and bony prominences. So think of a mattress that has a little bit of give in a certain place, so that when somebody has pelvis surgery, you don't want them to be like lying on the floor, because you know there's so much swelling and the bones are just being held together and all this kind of thing. So you have to have a mattress that can support this type of thing, so that it doesn't make their surgeries or anything worse. Okay. Next one. Ambulate. Ambulate. To walk or move about. So I ambulate when I go and use the restroom. You know, I walk to the restroom. Okay. So ambulation, then, if you ambulate is to walk, then ambulation is to walk or move in an upright position. So like you know that old song, we humans do, like humans do, I mean, walking in an upright position. Anatomy. Anatomy. The study of the structure of an organism. Now that should be pretty basic. If you're going into CNA, you know what anatomy is. Anemia. Anemia. Like sickle cell anemia, you've probably heard of that. Basically what it is the study, anemia, a shortage of red blood cells. So if you have a shortage of red blood cells, which carry oxygen all around the body, then basically your blood doesn't get that much oxygen and it starts starving itself on oxygen. So anemia. Aneroid sphygmomanometer. I'll write it down. I'm not exactly sure how to say that. It's a dial-type blood pressure equipment. So it's a piece of equipment that your doctor, nurse, somebody else is going to have to teach you how to use. It's just for taking certain measurements. Anesthesia. The loss of feeling or sensation in a part or all of the body. So you should know what that is when they anesthesize you. That's probably not the right word, but where they put you under, that's how they name it, when they put you under and you're totally unconscious as they do surgery on you. Sadly, some people wake up during surgery. That's the worst, trust me. But anesthesia, the loss of feeling or sensation in a part or all of the body. Maybe if they anesthesize your hand, you get to do hand surgery, or they do it in mouth with dental, that kind of thing. So just making something go numb, or all of you go numb, and your consciousness goes numb. An anesthesiologist, the medical doctor who administers the anesthetic, to the patient in the operating room. As you can tell, my English is not my first language, so okay. So the medical doctor who administers the anesthetic to the patient in the operating room. So anesthesia is administered by the certified anesthesiologist. Okay, that has anesthesia in the name, so you should be able to remember. Anesthetic, right? Because that word was just in the last definition. Anesthetic is what they use, to anesthesize you. Anesthetic, a drug used to produce loss of feeling, can be given orally, rectally, hopefully not, by injection, or by inhalation. A person who has been given an anesthetic is anesthetized. Anesthetized. Blah, blah, blah. Yeah. You keep up what I'm saying. So basically, they can do it by injection, do it in the gums, if you could have gum thing, dental. If you're Going under for surgery, they'll put the mask on you, so that's inhaling. Not particularly sure how they do it rectally. Is it a pill, maybe? And then given orally, probably just like I've told you with the inhalation. And then anesthetist, a registered nurse who assists in anesthesiologist, right? So, anesthetist. Anesthetist. It's a really hard word to say. The registered nurse who assists the anesthesiologist. So one of them has a nurse is a helper, if you didn't know. A nurse is not the doctor. A nurse has no qualification to say you have this or you have that. That's the doctor's option. So a nurse who helps this anesthesiologist, who has the certification, is the anesthetist. Next word is anger. A strong emotional response to displeasure, irritation, and resentments. Or resentments, it should say. But anyway, you guys know what anger is. But for ESL people, anger is just a negative feeling of strong emotional response to displeasure, irritation, and resentment. Anterior, basically in the front, or located in the front opposite of posterior, right? So posterior, post is back, anterior is front, and interior is inside. You need to know those words. Antiembolism stockings. Antiembolism stockings. So you guys have ever seen the kind of stockings they use where it kind of looks like they're wearing a cast after they've just had surgery or something like that? It's basically just a cloth type stocking, but it's kind of it's made or designed to promote blood to flow and to prevent the formation of blood clots in the bloodstream. Okay, so what it is a type of stocking that helps the blood flow through the body wherever it's specifically put on. Say you have weak arteries or veins there, or you have a weak heart and it just can't push it through, you might have to use that. Anuria. Anuria. I have anuria. It sucks badly. It's under the heading pruritus, shy bladder syndrome, so I should know this one pretty well. Inability to urinate. No urine output. Anuria. There's not really any funky way to just remember that. You just could have to buck up and remember that one. Okay, you guys should know this one though. Anus. Anus, also rectal. If you put something up the anus, that is rectal. Muscular opening that controls elimination of stool from the rectum. So that's pretty fancy words for saying that's where somebody takes a poop. Okay? If somebody uses their anus, either that is their lifestyle choice or they are having a poop. Apathy. If you guys know what the word empathy means, it's feeling emotion or showing emotion. Apathy is the lack of emotion. The definition is a lack of feeling or interest in things. I have apathy towards how paper plates are made. I just don't care. But I have empathy towards medical training. I have a good amount of empathy towards people who die from gunshots. But I have apathy towards how leather hats are made, you know. Or you could have apathy as in, I just don't care about that patient. They're extremely rude. I just do not care about them. I have apathy. Or you have empathy. I wish I could help that patient out. But it's either going to happen or it's not. Moving on. Aphasia. Aphasia. Loss of language or speech. You know those people who pretty much just can't speak as much as they want to? It could be numerous things such as dementia, or it could be they're paralyzed from the eyes down and they can't motion to you or speak with their mouth, or it could be some deformment, something like that, where they get hit by a truck and then their face is just deformed. Aphasia, the loss of language or speech. So that would be the speech part. The language would be the dementia part. They just can't remember how to speak, and that actually happens a lot. You'll be finding out a lot of that in the CNA stuff. Apical pulse. Apical pulse. A measurement of the heartbeats at the apex of the heart, located just under the left breast. You will be finding out a lot of this type of thing, of taking somebody's heart. I don't know if you can see with the bad lighting, but I have the stethoscopes on. You will have to look at the apical pulse, a measurement of the heartbeats at the apex of the heart, located under the left breast. So if I will have to use this, place it here, put these in my ears, and then you should be able to find the heartbeat. Apnea. Apnea. The periods of not breathing. So if somebody, say they're dying, and you know how they look dead 1 minute and they're not breathing, and then the next their body jump starts, and then the next minute the jump start didn't work, so they stop breathing, and then it jump starts again like a car. You know, it's trying to, but it's not, and it's trying to, but it's not, and they're having periods where they're not breathing, and then all of a sudden their chest rises, and everybody in the room looks at them, and they're like, oh, breathing again, but then it goes down, you know, and it's a constant flow. That could be apnea, periods of not breathing. Or I remember when I had my seizure, I went through apnea. I had one long session of where I wasn't breathing, and I went blue in the face, which is another term that we will be learning in the cyanosis. Just remember that one. I didn't even have to look that one up. It's not even on these pages, so I'm looking down, but I'm not seeing the word. Last one for this, appendicitis. Appendicitis. It's to do with your appendix. It's when you get an infection in your appendix. Inflammation, swelling, and irritation, an infection of the appendix, typically with pain in the lower right quadrant. Surgery called appendectomy is usually performed to remove the appendix. So you can have your appendix removed, and if it has a really big infection, you can have your tonsils removed, tonsillitis. But this is not tonsillitis, it is appendicitis, where you get an infection, swelling to where you don't want to have it anymore, and it becomes a discomfort or irritation in your daily life, your ADL, from the last video, your activities of daily living, if any of you remember that. Then you can have surgery to have your appendix removed. That's an appendectomy. So let's go over the words we've done in this video, and you can pause and try and remember, see if you can remember them. Alternating pressure mattress. Ambulate. Ambulation. Anatomy. Anemia. Aneroids. I'll write that one down. Anesthesia. Anesthesiologist. Anesthetic. Anesthetist. I'll write that one down. Anger. Anterior. Antingalism stockings. Anuria. Anus. Apathy. Aphasia. Apical pulse. Apnea. And appendicitis. Next video we'll be continuing with the A's.